We hear a lot about heart disease, but when it comes to what to look for and treatment options, there are more questions than answers. So today we're learning about non-invasive treatments from UI Health's cardiology program. Check it out.
What you feel on your chest is the ultrasound probe. Heart disease can manifest or can show itself in lots of different ways.
Typically, Dr. Athir Shroft says a person will complain of shortness of breath, chest pain, chest pressure or heaviness, or even unusual tiredness. If the pain is severe and not easing, it's time to head to the emergency room. But oftentimes, heart disease is quieter and progresses slow. And that's where the cardiology program at UI Health is able to help.
There's a lot of patients out in the world who've been told by providers or family members that they're too sick or they're too old to get their heart fixed. They might know that they have a heart problem, or they suspect that they have a heart problem, they have other health conditions or other issues that maybe make them nervous, or people have told them about that. And I really think here at UI Health, you should come and have an appointment and see our team. Really, we can get a lot of information just from talking to you, doing a quick physical exam with a stethoscope, an EKG, and then an ultrasound of your heart, which is all non-invasive. We can do all those in the same day and really kind of get a lot of that information and really try to help construct a treatment plan, an individualized treatment plan for each patient based on what we find from that.
And those treatment plans are much less invasive these days and don't require long hospital stays.
We help to pioneer some of the really less and minimally invasive procedure where people had to go through the groin area to have these catheters put in, which is very uncomfortable for people, especially bigger patients or older patients, because they can't walk for several hours after their procedure. And now with the less invasive approaches that we help to develop here, where you go through people's arms, that people can get up right off the bed, they can go to the bathroom, they can eat immediately after the procedure. And so that's really helped. And that's just an example of one of the innovations that we've created here at UIH.
Dr. Shroff points out cardiology has evolved in the past 10 to 15 years.
Cardiology traditionally, when the textbooks were all written in the 1950s, they were really focusing on white men. And we realized that persons of color and women have very different presentations and have very different risk factors for heart disease. And so I think that's something we've really tried to understand and try to emphasize here at UI Health.
All while maintaining its core mission.
We're very aware of our community and our surroundings here, and it's a core mission of our university and our organization is to serve our community, not only medically, but from a service standpoint. Our faculty, our nurses, our students are all in the community and help raise the health of everyone who lives here.
All right, take out your phones. We have a QR code on the screen there. If you think you or someone you know may qualify for a minimally invasive heart procedure, please contact UI Health's Structural Heart Program by calling the number on your screen, or again, pulling up that QR code. You can visit heart.uihealth.care. Lots of great information there. And the one thing to take away from this is that there have been so many advancements in treating heart problems and heart issues that you don't necessarily mean that you will have to go under the knife, or if you are, that you'll be in the hospital for many days to follow.
And they're able to catch stuff a lot earlier nowadays too, which is
Absolutely.
really helpful.
Earlier the better.
Yep.